Hi, everyone. Thank you for joining. We're going to kick off our new webinar series called Full Disclosure. This episode will focus on transitioning to a new PBM, and we will give everyone just another minute to join. All right, it looks like we've got a lot of folks on the call. We are so happy to have you all here for our kickoff webinar for the Full Disclosure series. And we will be digging into what it's like to switch PBMs. A lot of people don't go through this very many times, often only once in a career. So we want to help you understand what it means and what the reasons are and all the benefits that you can get from considering a new PBM. My name's Alyssa Johnson. I'm a pharmacist by training and lead the clinical strategy program at SmithRx, where we build out clinical solutions that lower costs and improve access for our SmithRx members. And I'm very pleased to be joined by Joy Gilbert, our SVP of Customer Success.
Hi, everyone. Joy Gilbert here. I am directly responsible for both our clients' experience here at SmithRx, but also the member experience. And so the onboarding process is very near and dear to my heart. I think it's very important to start off on a strong foot, and we're here to be your partner throughout the process, so it does not have to be scary. So let's get into it.
Thank you, Joy. Thanks for joining me for this initial kickoff. Now that we have you all here, we're going to go through the different stages of implementation and hear what some of the details are and questions to ask and things to watch for from Joy. And importantly, what does it look like regarding data and communication? Now, you will want to stay until the end of the webinar as we will have time to answer questions. Please list your questions in the Q&A box, and we will have some takeaways at the end of the webinar as well that you won't want to miss, because it will be a really great summary of call to action, next steps, and how you can make this happen smoothly. So let's get to it. As I mentioned, a lot of people don't go through this transition very often where they switch PBMs, and it can feel daunting and concerning, not just for your employees, but also for the HR benefits team, wondering what is this going to be like to have a new vendor. And it is a big decision. Drugs account for some of the biggest costs in healthcare today and can really make a difference in terms of how your benefits are managed. The process, while it can feel daunting, it doesn't have to be. And if you work with the right partner who can offer smooth implementations, that will make a really big difference as well. And so we really want to demystify what goes into the transition process so that you can understand what real strategies are to help with the member experience and then help your team go through this process with confidence, because we know switching benefits is a lot for the teams, and we want to be able to have you ready to do it smoothly. In terms of the member transitions, this is top of mind for everyone anytime a new benefit comes into play. And with the switching PBMs, it's really nice to make the change invisible to members so that they can just keep filling their prescriptions. The change happens, you go live, and they fill their prescription with their new insurance card, and they continue to get their medications. With that, we also want to make it manageable for the team and make sure that there's not a lot of escalation or calls. And Joy is really great at talking through some of the common experiences and has a lot of experience with this. And with all that, you can help build trust and clear communication through the proactive support. And so we're going to get started, but just to give everyone an idea, Joy, about how many groups do you bring over to SmithRx each year to show how common actually this is for your teams in that they support this?
That's a fantastic question, Alyssa. In the year of 2024, we onboarded 650 new employer groups onto the Smith platform. And when you do it that many times, a couple things happen. First, you learn very quickly from your mistakes. So we get to iterate and evolve and innovate very, very quickly. But also, you have a good number of repetitions to really solidify those processes and be able to bring forward best practices to your clients. So it's an exciting time for us when we win a new client and we're able to really hold their hand through the entire process. This initial implementation really sets the stage for our long-term partnership.
Thanks, Joy. And it's great you're all here today because you're proactively looking at ways to make healthcare and benefits better, and you're all forward thinkers. And so we want to give you the materials and tools to do that. And so we'll start with going through the 4 stages. Take it away, Joy.
Thank you. It really starts with making the decision. And for those of you that have already made the decision, kudos to you, because it is, as Alyssa mentioned earlier, it's not an easy decision to make, and it doesn't happen very often. And so the first stage of implementation is really that initiation phase that comes immediately after you've made the decision and chosen your new partner. And what you really want to see here is clear communication right off the bat. You should be assigned a project manager that will hold your hand through this entire implementation lifecycle and beyond. Additionally, most of you will have an account management team that manages your long-term relationship with your PBM. And we feel as a best practice, assigning that account team, your account manager, and any support resources at the very beginning of the implementation lifecycle is so important. That way, your account manager is there for all of the decisions and discussions that happen as we're going through the onboarding process. And so knowing who your team is from the outset is a critical component to have. You also want to have alignment on roles and expectations. So what can you expect from your partner, and what engagement and expectations can your partner have from you? And gaining that alignment early on really helps to avoid surprises during that transition period when the members are going live on the new benefit. So it's critical to ask your partners about those various components to make sure that you have the support you need throughout the process.
Thanks, Joy. And I just want to call that part out that the account manager is on the call during implementation. So it's not like you're being passed from team to team to team. That's a really important point that's unique and helps with continuity so that anything that you decide to have built that gets built, the account manager is aware and can support from before go live through the launch.
Terrific. So let's talk about the planning stage. There is a little bit of planning that needs to happen before we get into the meat of the implementation. And so those are things like contracting. So kicking off that contracting component is an important aspect here. Additionally, talking about the project plan itself and sharing some background information. So as an employer, you should expect your PBM to request some initial, very basic company information to get things started. And that might be just some corporate structure information, key contacts around who's signing the contract, who needs to go through review cycles, as well as perhaps your current or past benefit design documents to give them a starting point to work from throughout the implementation. So you should expect to see a project timeline. And what's important about a project plan and a timeline is that timeline should be ready to go from your implementation manager very early on in this planning process. Now, the thing about a project plan is it should be a framework, but not so rigid that you can't make adjustments based on your individual needs. Every organization is different, and we find that lots of companies may have different requirements related to the timelines things might need to happen internally within their organization. And so having the flexibility to make those adjustments to the project plan is really critical to get off on the right foot and make sure that the project will go according to what your needs are as an organization, as well as what your partner's needs are related to getting the work done in time for go live.
Joy, these are very important things for the plan to make sure get done. Can you help the group understand like what do these calls look like? How many people are on them? How frequent are they?
Exactly. And that's a perfect segue, Alyssa, into the next stage, which is really the implementation. And this is where the work really begins. Your implementation project manager should be setting up regular scheduled communications. We see a pretty wide variety of how organizations want to handle this, and it's really based on their individual needs. We have clients that maybe only need a handful of phone calls, 4 or 5 calls, and we can get the whole project complete in that period of time. With more complex projects, it may take longer. And so it might be a weekly call throughout the entire implementation lifecycle. There can also be what we call work stream calls. So there may be an entire work stream and separate calls happening related to member communications and marketing, which we'll touch on a little bit later, or data as well. Additionally, during the implementation, another key component here is that your PBM partner should be working behind the scenes concurrently on a couple of key items. The first one would be technical integrations with other benefit stakeholders in your ecosystem. So this might be your TPA, it might be a data partner, it could be a patient navigation partner, or other key stakeholders that either are sending data to the PBM or where the PBM needs to provide claims data or other data out to those other stakeholders. Those technical integrations should be running concurrently behind the scenes at the same time as the benefit implementation. And so that's something definitely to ask for and make sure will be happening. Here at Smith, we have a technical team that runs those integrations, and we really don't need to engage with the client unless we run into any particular obstacle or hurdle, but it should be fairly invisible to the HR team at the employer group as we move through those technical integrations. One of the other key components is the contract. I mentioned this a little bit earlier. And ideally, you would be able to work through the contracting lifecycle also concurrently with the implementation. Creating a situation where you have to already have these technical integrations or contracts complete before you start the implementation can really create a lot of risk within in your implementation timeline, because there may be things that get hung up along those work streams that could impact the overall implementation. So again, ideally, those are happening concurrently. As we get into the benefit design aspect of implementation, your PBM should be walking you through the process. And again, those early benefit design documents help the PBM start with a level playing field so that they can take your existing benefits, translate that into their documentation, and then start working with you very closely on any benefit changes you might want to make. So you may be evaluating copay dollar amounts, deductible amounts. You might be evaluating optional benefit categories such as weight loss or infertility. And there are a host of other benefit design decisions you'll be making throughout the implementation process. Your PBM should be a partner in those decisions and provide recommendations where you may not be sure. And those recommendations could be based on financial aspects or clinical aspects. One of the key things that to identify with your PBM partner during implementation is, what are your goals? Are you optimizing for cost controls? Are you optimizing for the least amount of member experience impact? And understanding where you sit on that pendulum, on that scale of cost savings compared to member experience. That helps your PBM come to you with the best recommendations to actually achieve those goals. So again, your PBM should be your consultant throughout those decision-making processes. And really, all of those insights go into getting to a final benefits design requirements document that you will sign off on. And once you are able to sign off on the benefits requirements, the PBM will then go start to build and configure the benefits in their system. They'll do some testing and quality control. It's a great idea to understand what their testing and quality control processes look like so that you minimize any issues that might happen post go live.
You alluded to this a little bit, Joy, but some of the things that are top of mind for employers are thinking, well, I'm switching vendors. I don't necessarily want to switch up a ton with my benefits design. How common is it to keep a pretty consistent benefit design from old PBM to new PBM? And what is that like if they want it to be pretty similar?
We actually see that very commonly. Often employers don't want to make a lot of changes to the benefit design, especially if you're optimizing for member experience, because they feel that the change of PBMs in and of itself is a big enough change. They don't want to also make benefit design changes at the same time. And we can certainly do that. We can completely mimic the existing benefit design if that's their preference. I think when you do that, though, you also lose the opportunity to make some tweaks or changes that might generate significant cost savings for the plans. Your employees know that you're going through this change, and so it's an optimal time to maybe make some changes. Not every organization has the appetite to do that, and it's completely fine to take a more conservative approach and turn on some of those cost saving levers further on in the future when maybe you have a little bit more appetite to do that. This is why understanding what your overall goals for the transition is up front really helps guide those decisions.
Yeah, and if they're switching and they know they want to change some things about the benefit design, but aren't quite sure where to start, how does that look, or what do they need to be prepared for? And how are they supported by the PBM teams in the process?
That's a fantastic question, Alyssa. I think that your PBM should be a partner with you in making those changes and letting you know the impact of those changes. And really, in my mind, there's two impacts that you want to look at a change like that. First is, what is the financial impact? I think for financial leaders on the call, they want to know, is the juice worth the squeeze? We hear that all the time. And so you want to understand what that financial impact is and really if that change is worth it to the organization from a financial perspective. The second way to think about it is the member experience impact, right? Most of the HR leaders we talk to really want as little member impact as possible. And having your PBM be able to walk you through exactly what that member impact looks like and how their internal teams support those members through those changes is critical. At Smith, we have a dedicated team that actually reaches out and holds the hand of every member going through a transition like that to make sure they get where they need to go and that they're happy with the results, whether that's lowering their own out-of-pocket costs, but also creating cost savings for the plan. And that can occur through a number of different changes. Your PBM should be able to explicitly articulate what that member experience and what that member change is going to look like and how they will support members throughout those changes.
And how permanent are the changes? Like if they are making some of these changes at the initial go live, but then they start to see their more of their data, or maybe they've never seen their data, and so they come over and they're starting to see their claims data for the first time, and they learn like, well, we did that, but we'd actually like to do something a little different. Are they stuck? What's the flexibility there?
They are not stuck. And I think we find this a lot, especially with clients that might be new to self-funded insurance plans. And there's a lot of flexibility there. And so we have many, many clients who take really a crawl, walk, run approach where they might start with just a few changes. And then as people get used to the new PBM and the benefit, they may actually leverage more changes throughout the year. And we have several mechanisms to be able to do that. And we'll talk about communication here in a little bit, but anytime you're making a benefit change, the key to that change is member communication. So you want to make sure you understand what that communication will look like as you go through that life cycle.
Thanks, Troy.
Great. So after we've done all the heavy lifting of getting those requirements documented, built, tested, QA'd in our system, we're really to the point of go live, which is the most exciting part here. We want to make sure that the implementation manager isn't just dropping off the project abruptly. There needs to be a nice, smooth handoff. And that means that your implementation project manager really stays until all of those loose ends from the project are wrapped up and resolved. And you want to make sure that your account manager, who ideally has been with you throughout this whole process, now picks up that ball and really takes the lead on the ongoing communication at go live and beyond. The other thing you want to do is you want to look at some post go live monitoring, and we'll talk about some data components in just a minute, but we can see through the data a lot about the member experience. So are claims processing correctly? Are we getting what we think is the appropriate amount of paid claims? Are members able to use the benefit? What do rejected claims look like? And are there reasons, specific reasons that they're rejecting that we may or may not expect? That post go live monitoring is really critical and you can learn a lot. The other thing that we like to look at is what's happening in our call center. So where is our member support team engaged? Why are members maybe calling in? And what challenges are they having so that we can react very quickly and not only help those members through that process, but if there's anything additional that we need to address and get out in front of, we can take those steps very, very quickly. So understanding what that post go live monitoring looks like, how the handoff happens between your implementation project manager and your account manager, and what that long-term relationship and member experience looks like is really critical at go live.
And Joy, could you give us an example? What is the top reason members contact after go live?
Yeah, I'll give you two. Really, the top reason at Go Live is that the member forgot to give their pharmacy their new ID card. And so the pharmacy is still processing under their old PBM information, which is very quickly and easily remedied. And we target some of our member communications specifically around that to try to mitigate that. We don't want members to have an issue at the pharmacy at all. What we really want is that it feels very seamless to the members. And for a lot of our clients, really all of our clients, well over 95% of their members will experience no change. They will get a new ID card. They'll go to the pharmacy. They'll pick up the same drug at the same pharmacy location, and there won't be any interruption for the member. And that's really the ideal situation. That's what we're looking for. And there may be that small subset of members that might need to make a change related to a formulary or a specialty pharmacy. We're going to talk about how here at Smith, we actually mitigate those changes and make that very smooth for the members. But what you really want is you want, your member population just to continue using the benefit. The pharmacy benefit is the benefit they're going to interact with the most. Most of us are at the pharmacy every single month for one reason or another, whether it's for ourselves or perhaps a family member. A lot of us only go to the doctor or the dentist once a year. And so even though the pharmacy benefit may seem like something that's maybe not as important, there's just so much more engagement with the pharmacy benefit than others.
Thanks, Joy.
So I wanted to show some examples of what that post-go live monitoring might look like. At Smith, we actually make this data available in our partner portal. It aligns with our value of transparency. You, as a plan sponsor, should have access to all of your data. That includes dashboard level data and how your plan is performing financially, but also very detailed claims level data so that at Go Live, you can actually go into the partner portal and you can see those claims coming through as paid, rejected, reversed. You can see your prior authorization cases. And that transparency is critical so that you know exactly how we're doing. And it also helps to hold us accountable as a PBM partner.
For those groups that haven't been able to see their data with their prior vendors, what are some of the biggest aha moments when they do start to see their own data? And what does that look like for them?
That's a great question. We run into this all the time. And I think for me, I'm always surprised that as a self-funded plan, that you wouldn't have access to your data because to me, it just makes logical sense that of course you would have access to your data. And so it is a surprise. But I think one of the pieces that is most surprising to our clients is being able to see the actual price on the claims and having sort of an eye-opening aha moment around really drug pricing.
And again, if you're going to be proactive in your benefit design, we want you to be informed. And the best way to do that is have a partner that gives you information. And so this gives you a lot to know what does your plan look like? What does the spend look like?
That's exactly right. And of course, as you run through that first 90 days of the transition, when you get to the end of the quarter, you want to see your quarterly business review and that quarterly reporting to see how you're performing. And again, transparency here is key so that you know exactly what's going on. In our partner portal, we make these reports available at that quarterly reporting cycle. So a little bit after the close of the quarter, our clients would be able to see this in the partner portal and then have a really robust conversation with their account manager about how things are going and any adjustments they might want to make.
Joy, one of the metrics on here is PMPM. Will you share a little more about that?
I would love to. So PMPM stands for per member per month. And this is the way that we at Smith like to measure financial performance. And so you may have been part of a legacy PBM arrangement where you're looking at AWP discounts and rebates. Here at Smith, we focus on the lowest net cost solution and we get away from those discounts and rebates. Because if you are chasing a discount, then it doesn't necessarily lower the cost of the drug if the discount is higher. So for example, if you have a drug that's $100 with a 50% discount, your net price is $50. But if you can get that same drug for $20 at a 0% discount, do we care about the discount? I don't think so. I think what people care about is actually how much are you writing the check for at the end of the month? And so by using a per member per month metric, which is just very simply taking what is the amount on the invoice divided by how many members I had on the plan that month and doing that calculation, you really can't hide from that metric as far as a comparator of what you're spending across vendors.
And that's not really an industry standard. Would you say very many groups even have been able to follow their PMPM prior to coming to Smith RX, or is that usually new for most groups?
It is definitely new for most groups. And we do a lot of education during the implementation lifecycle and beyond about this and why our approach is different. And it really helps drive very engaging conversation so that HR benefit leaders and CFOs can really better understand how their benefit is performing and how these costs can impact them.
And just to reiterate for everybody listening, because Joy talked about how to calculate it, but maybe if you want to just say it one more time, because this is a great takeaway for anyone to ask their PBM.
Absolutely. Take your monthly invoice. Take the total amount on your monthly invoice, which is an all-in amount. That should be your drug costs, your admin fees. If you're paying any other ancillary fees like prior authorization case fees or reporting fees, take the total amount of your monthly spend, divide that by how many active members you had on your plan during that same month, and you'll get the per member per month. So how many dollars are you spending per member on the plan in that month? And if you look at it month over month, quarter over quarter, then you really start to get a handle on your benefit and your spend and performance.
Thanks, Joy.
Great. I want to jump into data and communication because the underpinnings of this entire implementation process are really these two elements, data and communication. And they're really important to a successful implementation. And you should expect to talk about these a lot during the implementation, planning and work. So first on the data side, getting a few pieces of key data and information can really go a long way to smooth out the transition for your members. So we love to get historical claims. If you can get historical claims from your current PBM, there's a number of different data analyses we can do that will help smooth the transition for those members. So for example, being able to identify members that are filling at a specialty pharmacy and might need to change to a Smith specialty pharmacy. Also looking at members who may be on non-formulary medications. That allows us then to be able to identify exactly which members on the plan might need to make a medication change, and then target a very specific communication strategy around those members to make sure that they make those transitions very easily. Additionally, we really think it's a best practice to use open refill transfer files. You may hear them called ORTF. And this is a way that we can move prescriptions. It's a legal prescription transfer from pharmacy to pharmacy. Instead of doing it one at a time with a pharmacist on the phone, it's actually a file. And so we can move an entire population of members from one pharmacy to another. So for example, specialty pharmacies in bulk. And your PBM should be really spearheading coordination between the two entities in order to make these ORTF files happen and make sure they get ingested and set up in the new pharmacy system. This allows the pharmacy to be in a really proactive position as well, where they already have the prescription on file and they can start outreach immediately. We also ask for an employee census file. The claims file and the ORTF do not include member demographics. And that means a phone number, specifically an email address and perhaps an address. Having the phone, email, and address of a member allows us then to communicate to members prior to go live and smooth out that transition and make sure members are educated about any changes that might be happening that might impact them. So those three data files are really important components to the entire implementation process. We also request to get a prior authorization file. If your incumbent PBM can provide a prior authorization file, we can ingest that into our system and honor those prior authorization end dates so that those members aren't going through a new prior authorization at the same time as a PBM transition. And so those data components really go a long way. They help us communicate, they ensure continuity of care for your members, and really lower the number of member escalations you might have during the go live process.
Joy, you had mentioned some things for them to bring to the meetings earlier during the implementation calls and this. How do they know what all they need to bring? How is that communicated so that they can be prepared?
That's that's so important, Alyssa, because I want the key message here to be you don't need to know. Your PBM should be hand-holding you through this process and requesting these items. And so really all we need from you is engagement. Your PBM is the consultant here. They should be bringing forward these best practices to you. And these elements should be part of your project plan that we talked about reviewing in that planning process very early on in the implementation lifecycle.
You mentioned the open refill transfer files. SmithRx does not own any pharmacies. So can you help the group understand what that looks like, where the scripts are leaving, where they're going, and the purpose of the ORTFs?
Yes. So open refill transfer files, particularly in the context of specialty pharmacy, if you are with, one of the big 3 or 5 PBMs, they own their own specialty pharmacy, and you're probably pretty aware of that. So typically the ORTF is going from that PBM owned specialty pharmacy to one of our preferred network specialty pharmacies. That for us is Costco Specialty or Sendera RX. And we will guide through that transition. We will orchestrate that with the incumbent PBM's specialty pharmacy. So it's with that specialty pharmacy. There is an industry standard file format that is used. It's more of a technology play than anything at this point. And so we'll get that file from the incumbent specialty pharmacy and move that file over to our network specialty pharmacy. Our network specialty pharmacies actually will then set those members up in their system, make sure those prescriptions are set up, and they'll start proactive outreach to make sure those members know where they need to go for their specialty medications, and they'll prioritize those outreach in order of the member's next refill date so that we make sure no one goes without medication. All right, so we talked about when you can get data, but we also know you can't always get data. Not every PBM is willing to provide that data, or they might be charging very big ticket prices in order to get access to some of that data. And so we often have clients come over that don't have any of that data. That is completely fine. We have developed a number of strategies that help us still smooth out that transition, even in the absence of data. So for example, I talked about the prior authorization file. In the absence of a prior authorization file, our clinical team sets a recommended end date to prior authorization. So as we move those members over, we proactively load those prior authorizations in our system with a clinically appropriate end date. And as those end dates come up, we will automatically kick off those PA renewals. The nice thing about that is, again, your members are not having to go through a whole new prior authorization at the time of the PBM transition. It will happen as it would with their current PBM in a normal clinical cycle. Additionally, we talked about historical claims. If we're not able to get historical claims, there are data elements in the claims that are transacted between the pharmacy and the PBM where we can identify whether or not that prescription is a continuation of a treatment or a brand new treatment. And so using those data elements in the claim string, we've actually created a function where we allow those continuation of therapy claims to pay, and then we'll do a retrospective analysis. That way, the member is not getting a rejection at the pharmacy. We're still taking a look at that to make sure that that claim is appropriate, both from a clinical and a financial perspective. And then if we need to put up additional guardrails for that member or even do some outreach to that member, we can do that after the fact. And so we want to make sure that you know, even if you can't get the data, that's completely fine. What you should be asking your new PBM partner is, what mitigation strategies do you have without the data to make sure that this still goes smoothly?
Especially for the members on a high cost product like the specialty drugs. It sounds like then in most cases there's a lot done, whether there's data or not, for the members to keep getting their prescription filled. They may need to switch pharmacies, but it's a specialty product, so either way it will be delivered to their home. They'll still be able to access the same medicine and really not have to be like asking their doctor for new prescriptions or anything.
That's exactly right. And I think we hear from a lot of clients that they have angst around the specialty pharmacy transition. In fact, we find that's one of the smoothest parts of the whole transition because the member experience doesn't really change a lot. They're still working with a specialty pharmacy every single month to schedule their delivery, and the medication is still getting delivered to their door. The only difference is they're talking to a different pharmacy on the other end of the phone.
Thanks, Troy.
So communication, in my mind, is critical, and member communication especially. So you want to be sure that your PBM has a proactive communication approach, and it should be a multi-channel approach, not just letters or phone calls, because look, we live in a digital age, and a lot of members don't necessarily want to talk to someone on the phone. I know I myself as a consumer, I prefer to chat or email over having a phone call. So make sure that your PBM has a robust communication strategy. Make sure that providers are also in the loop. So providers that might need to write new prescriptions, it's important that the PBM has plans to notify providers where new prescriptions might be required. And that typically happens with variation in formularies. And again, a good PBM partner can identify that very early on in the implementation process and give you that data. You should also have access to employer-ready communication templates. So a lot of our clients want to send out their own communication about the PBM change and just need a little bit of information. We've developed an entire client resource library where our clients have templates that can enable those internal communications. Some of those are meant to be member facing, and some of those are actually more internal for the corporate teams. Proactive communication with the members is most important. And so when you're reviewing that project plan, make sure that there are communication milestones there with members, particularly those members that will experience a pharmacy change or a drug change. We love to send letters here at Smith. Even though it feels a little bit old school, it's extremely effective. People don't change their home address very often. And so they're more likely to receive a letter at home. Whereas if we're calling, they may not recognize our phone number and answer our phone call. And so proactive lettering in those situations is important. And again, the digital communications. One of the things that we do here at Smith is we do a welcome onboarding email series for our members. And so for the first 4 weeks they're on the plan, we actually send them an email to let them know who is Smith and how to navigate their health benefits and answer some basic questions around using their prescription drug benefit.
Joy, especially for plans that renew 1/1, January can be a very busy time for really any vendor that's in the benefit space. What does it look like for those that want to switch and go live 1/1, but are worried that it will take a while to get someone on the phone or get a hold, or their members will be waiting to get a hold of the PBM?
Yeah, I am very passionate about this area of our business. And I think being able to access a live person on the phone quickly is incredibly important. Last year, when we went through our first quarter cycle, and I mentioned last year we onboarded over 650 clients, our average speed to answer, which is the average wait time to get a live person on the phone, was less than 10 seconds. You should expect for your PBM to be willing to share member support metrics like average speed to answer, call volumes, call hold times, also abandonment rates. So how many calls are coming in that never get to a person and the caller actually hangs up before they get help. Those are very common member support metrics, and it's important to know, what those are with your partner and what their plans are and their staffing capabilities as we go through the busiest time of year in healthcare.
Thanks, Troy. You've been real candid about some of the little bumps in the road when groups go live. It's not like it's completely, there's no disruption or nothing, but it's a lot is done proactively to make it an easier process. And is there anything we haven't talked about so far that's kind of like the biggest concern regarding members being surprised or benefit leaders being surprised?
We have definitely covered a lot of ground here today. I think that, again, I can't emphasize communication enough. Being open with your employees about this transition, and also having the materials and the understanding from your PBM to be able to reassure your employees about what that transition is going to look like is key. And your PBM should be educating you about this. You should just continue to ask questions until you feel like you have the information you need to be confident in this transition, because as we talked about at the beginning, it is a big decision. This is just a quick sample of that digital email campaign I talked about. I'm sure other partners have different strategies, but we want to make sure we touch the members and meet them where they are from a communication perspective.
Thank you all for your questions. We're going to answer some common ones. If we don't get to your question, please know we'll follow up with you over email and get you more information. So we want to start out with member experience, Joy. We've gone over a lot of information specific to like PAs and prescription transfers, but just in general, and you had shown that timeline, what are members going to experience during the go live?
Yes, this is really important to understand. For well over 90% of members on your plan, and we typically see it more like 95 or 98% of members on the plan, they should be able to take their new ID card, go to the same pharmacy, pick up the same medication, and continue about their life. And that's really important. And we know that most members are going to fill a prescription in the first 30 days of the plan. And so that's why we target that 4-week life cycle on the email campaign, is because most members are going to pick up a prescription in that first 30 days. There may be some members that maybe have a 90-day supply that might lag a little bit longer. But we want to see really strong positive activity on the plan within the first 30 days of go live.
You had mentioned PAs already. It's usually a pretty big pain point because the members need to get the information from their provider, which can be cumbersome and time consuming. And so the question here that we just want to really make clear is, will my members have to go back through a PA process?
And with Smith, the answer is no. Now, we talked about two different ways to do this. One is getting that PA file from the incumbent PBM and loading that into our systems, or our going with our clinical team's recommendation and proactively loading those PAs into our system, and we'll put the appropriate clinical end date on those PAs. We do have clients that want customization in this area, and we're happy to customize. We have some clients, especially if you're really wanting to ensure a long-term smooth member experience, they may want to indefinitely approve those prior authorizations. And we can certainly do that. We also have clients that say, no, let's shorten that timeline a little bit. Maybe we want to make it only a 90-day prior authorization grandfathering period, and then we'll renew those at the 90-day period. So, you have a lot of flexibility, and your PBM ought to be able to make those adjustments based on, again, your goals with the plan.
And then the other member satisfaction is around switching pharmacies. So can you talk about what the SmithRx network is like and if members will have to change pharmacies?
Yes. So one of the amazing things about being a part of a PBM that doesn't own our own pharmacy assets is that we are completely agnostic. And that means that we have an exceptionally broad retail network, And part of the data analysis that we will go through during the implementation process is looking to see if the members who are currently filling at pharmacies, if those pharmacies are in our network. And if they're not, we proactively reach out and contract with those pharmacies so that those members don't need to make a change. That's really important from a retail network strategy. Additionally, we talked about the prescription transfers for specialty pharmacy. Same applies for mail order pharmacy as well. Those ORT files are really impactful in making those transitions very smooth. And if you have preferred specialty and mail order pharmacy partners that you'd like to work with, we're happy to reach out to those partners and look at creating new partnerships in order to support our clients.
There's a lot of behind the scenes work that gets done to make this a seamless experience.
Yes.
For members that are have the option for savings opportunities, so if they have expensive drugs or maybe high copays or something else, what will their experience be like, and how will they know if they can get their drug at a lower cost?
Yes. So here at Smith, we have a really robust savings programs. It's a suite of programs really where we can identify based on individual members and individual medications, which medications will drive the most savings and make sense to make a change. And again, this goes back to your goals around member experience and financial savings. Your PBM should be able to clearly identify who those members are and what those savings opportunities look like and let you know what the financial impact and what the member experience impact looks like. Here at Smith, that's a standard part of our data analysis. And we talk to you in depth about what that looks like member by member, claim by claim, so that you as a plan sponsor can make those decisions. And then if you do decide that you want to take advantage of those savings programs, our internal team of patient advocates works proactively with those members to get them through those savings pathways. And that can come in a number of different formats. That might be, again, some lettering, that could be phone, text, and email outreach to those members. Some of it we can do behind the scenes now that we have interchangeable biosimilars and generics. And so we really work to make those transitions not only proactively identified, but also proactively communicated and taking a white glove approach to make sure that those members get to where they need to go, still get an effective clinical therapy at the lowest price point possible.
Most everyone is here because they're considering a change. They want to figure out how to best do it, but change is hard. Change has uncertainties. Inevitably, there can be things that go wrong. So, like thinking of the elephant in the room, what if things do go wrong and there's issues with the data files, or maybe the data files from the prior PBM aren't quite what they thought they'd be, or something else with the setup?
Mhm. I think issue resolution is so core to a service philosophy. This is often really where we can shine as a partner. Um, we would love to say that everything's going to go perfectly, and we all know that things never go completely perfectly. And so knowing what you're going to do in those instances is really important. Um, Here at Smith, we have a lot of different plans and mitigation strategies and service recovery efforts. We have full playbooks that we've written behind the scenes that guide our efforts when those things happen. I think the key there is really the ability to be very responsive in those moments, identifying those issues, ideally through proactive monitoring in that post go live period, like we talked about. So, for example, you might see we have an unusually high number of rejected claims. And by the way, they're all in one or two claim rejection categories. Why is that? Your account team should really notice that and be diving in very early in the process. You may not have even received any member complaints about it. But what we want to do is proactively look at that, identify it, and then resolve those issues very quickly and work together with you to let you know what's going on and what we're doing to resolve it.
Thank you, Joy. We don't have time for the other questions today, but like I mentioned, we will be contacting you if we couldn't answer your question, but we do want to keep in touch. We have a new email, full disclosure at smithrx.com. So please send us questions and what you're interested in. We also have some wonderful takeaways as well. You will be getting a recording to everyone for everyone that registered, you'll be getting a recording and this transition primer so that you can have a clear takeaway in terms of what questions to ask and how to move forward with this transition. And of course, we would love to talk with you more here at SmithRx. So don't be shy, keep in touch, and we look forward to our next full disclosure webinar. And thank you for being our first guest, Joy.
Thank you for having me. It was wonderful.